My name is Mwanguzi Shadrack. I'm your doctor from Health Touch Uganda. And this whole month of January, we are going to be talking about high blood pressure. And we have a lot of things that we are going to do. We've done this in the past, but I feel there is a lot that we have packaged and put together to talk about high blood pressure and also make sure that our people actually benefit from this that we've termed the Hypertension Awareness Month. High blood pressure is one of the biggest problems we have currently. There are many people who are being affected on a daily basis. There are people who get high blood pressure. There are people who die because of high blood pressure. There are people who get complications because of high blood pressure. Globally, we have about 1.28 billion people in the ages of 30 to 79 who are currently living with high blood pressure. And the biggest percentage of these, about 2/3, are found in the low and middle income countries, especially within the African region covered by the WHO. And the most unfortunate bit is majority of the people who live with high blood pressure are actually not aware that they have this problem. Here in Uganda, if you went out to the streets randomly and checked people's blood pressures, you'd actually find about 30% having high blood pressure. That is simply about 1 in 4 people having high blood pressure. But the most unfortunate bit is majority of those that have it actually don't know that they have this high blood pressure. For example, if you went to the streets, measured people's blood pressures and then kept isolating those that have high blood pressures and collect 100 of them, and out of these 100 you start asking one by one to find out if they ever knew that they had high blood pressure, you would only find 8. And even out of these 8, if you went ahead to find out how many of them are doing something about the high blood pressure that they have, you'd find less than half. So that means out of 100, you have less than 5 people who are aware and are doing something about this high blood pressure. And yet, not knowing that you have high blood pressure, or knowing and you don't do anything about it, will put you at risk of getting severe damages to very important parts of your body, like the brain, the heart, the kidneys, and other blood vessels, and the eyes. People have become blind just because of untreated high blood pressure. So it's very important that every one of us gets to know about what exactly high blood pressure is, and probably some of the things that you can feel in your body when you have high blood pressure, the things that put you at risk of getting high blood pressure, the severe damages or complications that you can get in case you have a high blood pressure, and then get to know some of the things that you can do to prevent a high blood pressure. And if you're one of the people that have it, you would also benefit from knowing what exactly you need to do in order to keep alive and safe, because it's actually possible for you to live on normally like any other person, only that for you, you probably have to do extra things that other people are not doing. So those are some of the things that I'm going to be talking to us about today, and how I wish every one of us can actually learn something. So what exactly is this high blood pressure thing that we keep talking about? I want to give you a scenario. Look at water flowing through a pipe. At the end of the pipe, if, for example, you have a pump, a water pump, and you set it to pump this water at a very fast speed, from the other side of the tube or the pipe, it will also be gushing out at a high speed and splashing. On the other hand, if you reduce the pressure, or if you reduce the speed or the energy with which the pump is pumping this water, it will just be dripping out slowly. It's the same thing which happens. All of us have a pump in our chests. We call that the heart. It doesn't rest until you die. It keeps pumping blood every day, even when you're deep asleep. But the speed with which this blood runs in your body or in your blood vessels can vary. For some people, it keeps running at a good pace, normal speed. For others, it runs really slow, and for others, it runs at a very fast speed. So the energy or the force this flowing blood exerts on the walls of the blood vessels exerts what we call a pressure, or generates what we call a pressure. And that means everyone has a blood pressure. It only becomes a problem when it either increases above normal or it drops below normal. In normal individuals, blood pressure is usually noted as an upper figure, which we also call the systolic blood pressure, and a lower figure, which we call the diastolic blood pressure. The upper figure represents the pressure in your blood vessels when your heart is pumping out blood or when your heart is contracting, and the diastolic corresponds to the pressure in your blood vessels when your heart is relaxing. And we usually want the upper one to be around 120. We have a room of about plus or minus 10, and then the lower one we want it to be around 80 plus or minus 10. So when it goes to the upper one, when it goes to 130 and above, it becomes a problem. The lower one, when it goes to 90 and above, it also becomes a problem. There are things which put us at risk of getting this high blood pressure. One would wonder what exactly causes it even before we go into the risks. There are things like diseases of the kidneys, diseases of the glands that produce hormones like the thyroid gland, the adrenal glands next to the kidneys, which can cause a high blood pressure. And for example, if you have this disease of the thyroid gland and you deal with it, even the blood pressure will go. But that's in just a small fraction of people. Majority of the people get high blood pressure without anything to exactly explain as to why they've got it. However, there are things that we've studied and we know that put us at risk of getting this high blood pressure. There are two broad categorizations. We have what we call the modifiable risk factors and the non-modifiable. Modifiable means there is something you can actually do about it. Non-modifiable, you can't do anything about them. For the non-modifiable, we have family history. You find people come from families where there is a tendency of people getting high blood pressure. Like you have a sibling, you have a relative, you have an auntie, a father, a mother who has high blood pressure, you stand a chance to get this high blood pressure. Age. As we advance in age, especially 65 years and above, our risk also gets stepped up. And then those other diseases like diabetes, diseases of the kidneys, they all put us at risk, and yet probably there is nothing we can do to prevent them. Now, none of us decides which family they are born from. Then we have the non-modifiable, the modifiable risks. We have diet. If you can put your diet in check, you will prevent that. So people who usually eat a lot of salt, those that have a tendency of even adding raw salt to their food at a higher risk. We have people that don't eat vegetables, they don't eat fruits, they eat more of the non-saturated fats. Those are the kind of fats that usually are solid at room temperature, like the ghee, the animal fats, and so on. And then people who eat a lot of processed foods, that's poor dieting, and it increases your risk of getting high blood pressure. Then people who are obese, when your body weight does not match with your height and you're either overweight, obese, morbidly obese, you stand a higher chance. The people that smoke and drink alcohol are all at a risk. Then the people who are usually stressed, stress can actually cause or can put you at a very high risk of getting high blood pressure. And to those that have it, getting stressed makes the situation even worse. So those are some of the things that really put us at risk of getting a high blood pressure. And one would now wonder, what exactly does one feel when they have a high blood pressure? It's very unfortunate that people have high blood pressures and yet don't feel anything at all. In fact, medically, we call it a silent killer, because right now you can be with someone, or rather you can go to bed with someone or even probably have supper together, say an evening prayer together, they go to bed, and in the morning they are nowhere to be seen. They are dead, or they sustained a severe complication like a stroke, they are unconscious, or they are paralyzed, they can't touch, they can't walk, and all those other things, and yet they were apparently fine. So high blood pressure has the ability to take your life without a warning. You may have it markedly elevated, but when you don't feel anything at all. However, for a few, there are symptoms that they can get as a result of this high blood pressure. And some of them include recurrent headaches. You find every morning you have this slight headache. And then others have a bit of nosy bleeding, occasional nose bleeding. And then others get a bit of blurry vision. They are what we call palpitations, when you start noticing your heart pumping in your chest. Under normal circumstances, that's not supposed to happen. Your heart keeps pumping when you are not even aware. But when you start recognizing the heartbeats, then probably you have a high blood pressure. Sometimes the heart even starts pumping irregularly. And then for others, you get nauseated, you even go ahead to vomit, the general fatigue. It's not like you've been doing something heavy, but out of the blue you feel fatigued even when it's early in the morning. Those might be signs of a high blood pressure. It can cause confusion, dizziness, and others can even faint. Some other symptoms come as a result of the damages that have already taken place on the different parts of your body. Because like I told you, this high blood pressure has the ability to damage important parts or structures of your body. Some of them are brain, heart, eyes, kidneys. And when, for example, the eyes are damaged, you will find issues with your vision. It might start as blurry vision, cloudy vision that comes on, and then you get better. And then as it advances, you might even get blind, totally blind. If it's the heart, when the heart gets issues, it might start pumping or beating irregularly. It might stop beating suddenly, what we call a heart attack, and it usually kills people, especially here in our low income settings where we don't have effective emergency services. And then it can also go into a state of failure. It doesn't completely stop pumping at once, but then its effectiveness in pumping this blood kind of goes down. And remember, your heart keeps supplying blood to the different parts of your body. So if these parts of the body that support you in your day-to-day work are not receiving enough blood, which is meant to give them the energy and all, then you're not going to be able to do as much. You find someone just makes 2 footsteps, walks up a staircase, and then it feels like they've been climbing up a mountain for 5 hours. Then you find you can't even lie flat. At night you have to spend the whole night seated. Your legs swell up, even the entire body, the tummy, and all those other things. And then if it's your kidneys, remember kidneys play a very important role in sieving out waste products in your blood. So when they get damaged, those wastes are going to accumulate in your blood and you're going to start getting problems. When your kidneys get diseased, your legs will swell, your face will swell, you will start getting confused, your blood levels, you will go down and you become anemic, and many other things. When your brain gets damaged, usually there is what we call a stroke. Stroke means a part of your brain has been damaged as a result of either a blood vessel bursting or a blood vessel blocking. Whatever the case, it results into blockage of blood or a certain part of your brain not receiving enough blood as it should, which eventually gets damaged. And remember, the brain controls other body parts. So when, for example, a part of your brain that's responsible for your vision gets damaged, you're not going to see again. When the part of your brain responsible for moving your leg gets damaged, you're not going to walk again or feel using that part. So you can get a stroke and get paralyzed. Some people, most of them actually get paralyzed, either both hands or one hand, or both the hand and the leg on that side, and many other things. So those are some of the complications that people can actually sustain as a result of this high blood pressure. In case someone has a high blood pressure, what are they supposed to do? It's very, very, very important, first of all, for everyone to have an opportunity to at least check your blood pressure once or twice in a year. The process of measuring your blood pressure is not painful. It takes about 2 to 3 minutes. We wrap a cuff around your arm, press a button or take it manually, and within no time we shall be done. It doesn't involve any pricking. We shall not take off blood. We shall not hurt you in any way, and you will know about your blood pressure. Some of people get worried, be like, what if they tell me I have this high blood pressure, and I start getting worried, and maybe I even die prematurely because of the anxiety and the stress. Well, even if you don't measure your blood pressure and you have it, you will still sustain the severe complications. So it's better to live knowing that you actually have a problem than ignorantly living on thinking you don't have it and yet you do have it. Because when you get to know, you will start doing something about it to make sure you continue living on, because high blood pressure actually kills. So if you come and we check your pressure and we find it a bit high or elevated, we may not start you on treatment there and then. We shall tell you to maybe rest for some time and then we'll measure it again. In case we are not convinced even after that, we might tell you to come back the following day and measure it again. Now, if we measure it on 2-3 different occasions on different days and we find it high, then we shall advise you to start treatment. This treatment has been found to be very effective. I'm not going to give you false hope that when you use it, you will get fine and you won't have to take it again. However, for some people, we know actually, they reach a time and they don't need the medicine. And for others, you will have to take the medication for life. You will have to take the medication for life. That is not good news. But you just need to know why you are taking this medicine. For as long as you need the medicine and you have not taken it, you will be at risk of getting the severe damages, sudden death inclusive. You might get a bit of side effects with this medication. For example, some people after starting the medication feel a bit of headaches, abdominal disturbances, they might feel a bit of dizziness, they might feel a bit of nausea, they might feel a bit of being sleepy and drowsy and all those things. So if the side effects are that serious and you feel you can't do with them, instead of dropping the medication, please come back to us. We know how to always modify the treatment. We know there are different classes of medication that we can try on. Might find today you have tried this and it has given you bad side effects, and when we give you this other one, you'll actually do well. And when you just drop taking your medication, it means you have just given up on your life. But if the side effects can be tolerated, for example, it's a slight headache, it's a bit of drowsiness that you can actually stand, then you have no reason to stop taking your medication. For example, if it's drowsiness, you can now start to take your medication late in the evening when you're going to sleep. If it's a bit of abdominal discomfort after taking the medication, then we advise you to take the medication after food. If you get a bit of severe dizziness, then most likely when you take this medicine, your blood pressure actually drops, and it's necessary then to measure your blood pressure after taking the medication or at a time when you feel dizzy. So we get to know how to adjust the medication. You might need to reduce on that dosage. But it's not good for you to drop taking your medication unless it's an advice, it's an instruction or a recommendation from healthcare providers. If you go to a place and they tell you they are treating you for high blood pressure, whatever the place, whatever the medication they are giving you, however friendly those people are, but are not measuring your blood pressure, are not comparing your initial blood pressures with the new ones on treatment, then you are in a wrong place. And my advice for you is, please run for your life. there is a lot at stake. High blood pressure is very dangerous. It's extremely dangerous. However, the good news is if you do what you're supposed to do, you will actually live on normally and prevent those severe complications. For you that doesn't have this high blood pressure yet, there are things you can do to prevent it. It's important for you to have a nice or a healthy diet. Have a lot of greens every day. It's important to have fruits every day to reduce on those fats which are usually solid on room temperature, to reduce on the amount of salt you put in your food. It's important to reduce on the amount of carbohydrates that you eat. You find someone is eating a plate that has cassava, sweet potatoes, rice, posho on the same plate. Those are all carbohydrates, and your body doesn't need much as your feast is what your body needs. So if you're eating more than that, then it's going to take off just that, and every other thing is going to be converted into fats or cholesterol that is going to be stored in your blood vessels. That's then going to damage those blood vessels, clog them, and you're going to get a high blood pressure and many other things. It's important for those that smoke to stop. And if you're someone that has a high blood pressure and you continue to smoke, then we actually have no description for the kind of person that you are, because that's dangerous, and it's because you are choosing to be stubborn. Those that drink alcohol, we advise that you reduce on the amount of alcohol you take. If you think it's unavoidable for you to drink, we recommend a bottle of beer for a lady and 2 of them for a gentleman. More than that is hazardous to your life. There are many questions that people ask about high blood pressure. Can someone exercise if they have high blood pressure? Yes, you can actually exercise depending on the level of on what your heart and physical health can actually stand. But exercise is very important, and it's one of the things that actually prevent getting high blood pressure. The exercise should be intentional, about 30 minutes every day for at least 5 days in a week, and it should be consistent. It's not advisable for you to do exercises today and then tomorrow you don't. And it's also not good for you to say, for me, I will use all the minutes I was supposed to exercise this whole week to exercise in just one setting. That's also not as effective. It's important for these minutes. We estimate around 150 minutes in a week, spread out on different days. That's about 30 minutes every day for about 5 days in a week. That's very, very important. To keep a normal weight, make sure the weight that you have matches with what your height actually requires. High blood pressure cannot be transmitted from one person to another. If you have a parent that has a high blood pressure, if you come from a family where people have high blood pressure, you're even supposed to pay extra attention in as far as conducting your life is concerned. High blood pressure is not a death sentence. There are many people who have high blood pressure, but because they've embraced it, they've taken a personal responsibility to know how it is, they've actually continued to live on normally like any other person. If you have a high blood pressure, I want to recommend that please get yourself a monitor, a blood pressure machine that can actually measure your blood pressure at home. Because when you are home, you measure your blood pressure without those stresses and all, then you get the accurate figure. And sometimes you even come to hospital because probably you're taking medication, you measure the blood pressure at home and it's not where we want it to be. But if you don't know, then you will continue assuming that the medication is working for you and yet you're actually not benefiting. That machine is affordable to many Ugandans. But to those of you that probably are not able to get it, at least once in a week, go to a nearby clinic, health facility, and get your blood pressure measured. When you do that, coupled with eating well, coupled with exercising and doing every other thing that we tell you as we teach you in hospital, you will be able to live on normally like any other person. I want to conclude by saying every person can get a high blood pressure. It's not only the elderly, it's not only the young, it's not only the ladies, it's not only the men. Anyone can get a high blood pressure. And before you get to find out, don't celebrate yet. Make it a point to go to a health facility and you get your blood pressure measured. By so doing, you will live on normally like any other person. In case of any other questions about high blood pressure and other health issues, please reach out to us on all our social media platforms, on all our sites, on YouTube, on Facebook, Instagram, Twitter, TikTok, and even WhatsApp, so that you get to learn about most of those other things. All the platforms are in the names of Health Touch Uganda, and if you would want to join any of our WhatsApp groups, just send us a message on 0778 788 707 and request to be added to any of those WhatsApp groups so you can get in direct contact with our consultants. Thank you so much. Mwanguzi Shadrack, Health Touch Uganda. Follow the light.